I am Neetha Dick, and I'm honored to be reading the citation today. The highest distinction the Senate of a university can confer upon an individual is an honorary doctorate. At the University of Manitoba, the criteria include distinguished achievement in scholarship, the arts, or public service. Our honorary graduate this afternoon is Janice Currie. A leader, advocate, and skilled nurse, Janice Currie has dedicated her career to shaping the Manitoba healthcare system for the nearly 4 decades. Ms. Currie demonstrated versatility and resourcefulness as a senior nurse leader and administrator, using her talents to streamline processes and transform complex structures, always in service of delivering improved patient outcomes. According to Ms. Currie, compassion and respect for the needs of the individual should be the foundation of the healthcare system. With this principle at the fore, she built effective coalitions and partnerships with a variety of nursing, academic, and healthcare institutions in Manitoba to advance nursing practice, resolve operational issues, and develop long-term strategies for nursing and healthcare as a whole. An advocate to the core, Ms. Currie spearheaded complex initiatives to improve healthcare in many areas, including women's health, eating disorders, transplant services, seniors, patient safety, emergency and critical care, and cardiac sciences. Ms. Currie began administrative roles early in her career as an assistant head nurse, and program manager, advancing later to executive roles as CEO at Deer Lodge Centre and 11 years at Winnipeg Regional Health Authority as vice president and chief nursing officer. She also developed and chaired the Regional Nursing Leadership Council. To support these roles, she earned a Master's of Science in Administration in Healthcare in 1995. As a leader in the field, Ms. Currie maintained her patient-centric values while applying a profound appreciation of the fact that the practice of nursing and the education of nurses are inextricably linked. Her vision helped enhance the scope of clinical practice and healthcare system operations and the development of sustainable workforce models. Currie led with respect for her staff, their abilities, and contributions. She saw herself caring for patients by supporting the skills of thousands of employees. Ms. Currie has received many awards, including the Canadian Nurses Association Centennial Award, the Canadian College of Health Service Executives Leadership Recognition Award, and the College of Registered Nurses of Manitoba's Lifetime Achievement Award. Though now retired, Ms. Currie remains committed to providing service to the community and currently serves as a member of the University of Manitoba College of Nursing Advisory Council. She uses her expertise to help shape the future of healthcare and education. Madam Chancellor, it is an honor for me to ask, on behalf of the Senate of the University of Manitoba, that you confer a Doctor of Laws honoris causa upon Ms. Janice Currie for her outstanding service and leadership, and for inspiring generations of nurses and nursing students, faculty, and colleagues.
By virtue of the authority vested in me as Chancellor of this university, I admit you to the degree of Doctor of Laws honoris causa, with all the rights and privileges thereto appertaining.
I got all excited, I forgot to give her her diploma. I would like to invite Dr. Janice Currie to please address our convocation.
Thank you.
Well, they've said everything I was going to say. Good afternoon, President Bednarik, platform guests, family and friends, and graduates. Since I was nominated for this degree last fall, I've been reflecting on the question, why me? The other recipients this year seem to be better known and have done very broad impacts on their communities, and it seemed more than what I have had. So you may have wondered the same. I set out to research past recipients of honorary degrees to put all of this in some context. Since 1911, honorary degrees have been awarded, and there have been at least 616 of them. Now, this is a number you'll want to remember. 88% to men and 12% to women. So that might be a clue as to why I'm here today. Of these 69 women, 4 are nurses. The first in 1956, the next in 1992, and then 2 in 1993. The first woman to receive an honorary degree was Cora Hind. You may have seen her statue at the legislature in 1935. She was a journalist, agriculturalist, women's rights advocate, and a suffragette. And the first woman, I'm told, to own a typewriter west of Toronto. So for that, she had an honorary degree. I'm clearly not in her league. Up to 1960, there were 8 more awarded to women. From 1960 to 2000, another 38. You can see the impact of women's lib in the 60s, which is what we called feminism, and some of us remember that. Many more women began to go to university. Between 2000 and 2010, there are many more, and in 2022, there are 5 men and 5 women. We're finally catching up. I've seen such changes in the 50 years since I graduated. Health professions are much more gender equal, and it's an interprofessional faculty. Agriculture, which was all men, and human ecology, which was called home ec and was all women, now study and learn together. All of this in a world increasingly aware of the links between food supply, environmental issues, and promoting health and preventing disease. I just need a little water. It's 50 years last month since I graduated with a 4-year degree, a Bachelor of Nursing, just as some of you are doing today. It was the 6th year of that program, which followed a couple of decades of certificates of teaching, supervision, and public health for registered nurses. Some registered nurses joined us as well to earn a degree, and about 25 of us graduated in 1972 from the 4-year program. There was no simulation lab that you've learned in now. We learned injections on ourselves and each other. There was no building. We wandered from the administration building in first year to the 4th floor to Duff Roblin, and then to the now demolished East Gym. I recall there were mice there, and they weren't for research. Our clinical experience was hard to find, as many hospitals still offered diploma programs to RNs, and prioritized those students, of course. As a new grad, it wasn't easy to get jobs, and I recall my first interview at the General Hospital, now part of HSC. HSC didn't exist then either. "We don't hire nurses from there," said Miss Turner. I've wondered since if it was the $39 a month academic allowance that they had to pay. So I went around the corner to the rehab respiratory hospital and was hired on the spot to start the next day. Most of my classmates worked in public health, as that was a big priority in the program. So I thank the 2 visionary nurses, Diane Letwin and Doris Setter, who took a chance on me and influenced my success from that day on. They were followed by several CEOs who encouraged and taught and mentored me over the years, and I'm grateful to all of them. Those are the people you will be looking for in your career. So I guess I was something of a pioneer. For 40 years, as Neetha has outlined, I worked from an assistant head nurse to the CEO at Deer Lodge, and finally to the role of Vice President and Chief Nursing Officer at WRHA. Most of those roles were in newly built organizations: Concordia, Seven Oaks, Deer Lodge Center, and WRHA. That's another opportunity that I wouldn't have missed for anything. There were many opportunities to hire staff. There were 26,000 staff in WRHA, and 7,000 of them were nurses. Many opportunities to hire those staff, to build teams and processes, and to influence careers for others. The opportunity to enable nurses and other people as well to support their families and to care for patients through so many others was the most rewarding part of my career. A bonus was the opportunity to represent nursing to the public in the media. And it's been 12 years, so I'm a little rusty. But whether controversial or positive, there was always a chance to acknowledge the skills and efforts of healthcare workers in those stories and occasionally that part did not hit the cutting room floor. Those of you who graduate today have similarly pioneered by adapting your education to a pandemic. New processes, new roles, and general description of your education will always be what you remember that led you to today. The interprofessional collaboration within healthcare had its roots in our work 20 years ago and has served you well in adapting to COVID. It holds great promise for the future. As you review and research those processes and roles that were developed in response to COVID and proved to be promising, think about how far we've come in the short time that you've been in your program and how much you've already contributed to healthcare in Manitoba. Think about healthcare in those large terms and be open to the opportunities that will present themselves. I have had other awards in my career and I'm grateful for all of them, but none were so great as an opportunity to contribute to the healthcare of many, many Manitobans and to guide those who provided it. 12 years retired, I'm always there thinking about all of you. Despite the challenges that healthcare has encountered in the last 3 years, I have faith in those who manage and provide it and salute all of you for the future contributions you will make, whatever your field. Thank you to the hundreds I've met in my career, to my family who are always there to make it possible, to the friends who are here today, and to Dr. Dick and Dr. Postal for their nomination. So, back to the beginning, why me? Healthcare workers have made enormous contributions over the 50 years, but none so visible and lasting as those of the last 3 years. I represent all of you and honor your work. Take care of yourselves, and that little guy up there, wherever he is. Take care of each other, and take care of your patients. Today is an honor for us all. Thank you.